But again, I'm saying confidently the cost of treatment will be one-fifth of what it costs in Singapore, or maybe one-tenth in Singapore. Firstly, I would say stay healthy, follow a good lifestyle. Two, get regular checks up. So Apollo has India's largest preventive health system, which will again be happy to bring to Indonesia. So you can get your regular checkups done so that in case something is going wrong, you can catch it early and you can make sure there is an early detection and you can take the required treatment immediately.
Dr. Sen, thank you very much that your hospitality is very useful for our patient and they are from Indonesia. Can you tell us how come the hospital or the healthcare in India become so advanced right now? Please.
First of all, Pa, thank you very much. Thank you for your time today. Thank you for your trust in Apollo. I can give you a little background on Indian healthcare. In the 1980s and 90s, the healthcare was not very good. Indians used to travel outside of India to places like US and UK for advanced treatment. But in 1983, our founder chairman, Dr. Reddy, started the first private hospital in Chennai. His aim was to make sure that people get good quality health care at an affordable price. So that is how he has driven the healthcare in Indian private sector. In fact, he's called the father of modern healthcare in India. He brought in the best of technology. India has the skills in terms of highly qualified doctors and nurses. I'm sure you have seen globally also the best of doctors are a lot of times Indians. So Dr. Reddy created a platform with Apollo hospitals to bring the most advanced technology and infrastructure. And in the last 40 years, he's created a revolution in healthcare, where now we are at a stage where we don't have to go out for any treatment, but people from more than 140 countries come to Apollo hospitals in India because of the great technology, because of the advancements, because of the very affordable cost of treatment at Apollo in India, and very importantly, the warm hospitality and the tender love and care approach that we follow. So these couple of factors have led to a very good healthcare system in India and led by Apollo hospitals.
Yeah. And then, how is the state, your country, the state treat to the hospital or the healthcare of the people and the Apollo itself?
So the healthcare, like any other country, comes under the jurisdiction of the government also. So we have very good public hospitals.
Okay.
So the healthcare, like any other country, is also a responsibility of the government. So we have very good public hospitals by the government of India and the state governments in various states. While they offer the technology and services, but sometimes they are limited in the advanced technology, which is available at private hospitals in India. And the government of India had, in the last 10-20 years, created policies to encourage private healthcare. So the government, we should thank the government of India for that, for creating an environment where private hospitals can set up and create a setup for people to access healthcare, because government alone cannot serve a population of 1.4 billion we have in India. So that has been helpful, and in fact the state governments and the private work together. This facility where we are sitting now, right at Apollo Hospital in Delhi, it's a PPP between government of Delhi and Apollo hospitals. The government of Delhi also has an equity stake, and the overall hospital operations and management is done by Apollo Hospitals Group. So there's a great synergy in this.
So you said that yesterday you have 60 or 70?
We have now, see, over the years now, starting from the first Apollo hospital in Chennai, we have 73 hospitals in the Apollo group. We have 6,000 retail pharmacy stores. We have medical colleges. We have nursing colleges, Institute of Physiotherapy. We have Apollo Research and Innovation Division. We have Apollo International Radiology, Teleradiology Divisions. We do a lot of work in digital health. So we are present across the spectrum of healthcare.
So about the surgery of the livers, can you explain us how the development of the surgery, liver surgery?
So, liver problems are quite common and the incidence is growing globally, even in India, and what I learned from Indonesia as well. We have a Apollo hub, Apollo office in Jakarta, where the team is trying to create access for people to have reach out to Apollo hospitals, and that is how we got the reports of the honorable. And our specialist reviewed the reports, and then he advised that he needs a transplant surgery. And as soon as he arrived, he was admitted, evaluated, and I'm very pleased to share he underwent a very successful surgery. And we are continuing to pray for his good health and a healthy life going forward.
Since when the liver surgery began in India?
Oh, we started as Apollo. We did the first pediatric liver transplant in 1998.
1998.
So it's been almost 26 years now. And we are doing the surgeries regularly now at Apollo Hospital, at this facility in Delhi, and other flagship hospitals at Apollo Hospitals in Chennai, Apollo Hospitals Hyderabad, Apollo Hospitals Bangalore, Mumbai. So we have multiple liver transplant and kidney transplant programs across the Apollo group.
Do you know the figure how many patients already are reserved?
So last year we received overall 200,000 patients.
Last year?
200,000 patients for all types of procedures. I don't have the number right now with me for liver, but we can let you know. But they come primarily for liver transplant, kidney transplant, bone marrow transplant. We do a lot of patients. A lot of patients come for oncology, orthopedic surgeries, knee replacements, spine surgeries, neurosurgeries. So we offer services across the care of tertiary healthcare.
So if you compare the price for the surgery here with the Singapore or other countries, can you explain us?
So one of the common surgeries we do is a heart surgery, what is called as a coronary artery bypass graft surgery. We know in US it costs upward of 100,000 or 125,000 US dollars. What we've learned that it costs in Singapore is around 50,000 to 60,000 US dollars. In India we do that surgery at 5,000 to 6,000 US dollars.
5,000.
So it is almost 1/10 of cost in such surgery. So many procedures like that are done at a much less. Like I said, our chairman wants to make sure healthcare of high quality is available at affordable rates.
What about in the liver surgery? Can you give the figure?
So the liver surgery would cost anywhere again 200,000, 300,000, or maybe $500,000 in US. In Singapore, I think it should be around 200, 250,000 US dollars. In India, we do between 30 to 40,000 or 45,000 US dollars. So it's much more affordable here.
How about the kidney?
So in kidney transplant, in fact, this facility is world's busiest kidney transplant program, the Apollo Hospital. We do the cost of kidney transplant is between 12 to 15,000 US dollars, whereas again it could be 100,000 in Singapore or maybe 130,000 US dollars in Singapore. So it's again much more affordable.
Yeah. So
apart from the affordability, the outcomes are excellent. So we have monitored our outcomes and compared with the best hospitals globally, and we match right up there. Our success rates are as good as any of those.
Do you know, Doctor, if we compare with Singapore, like in this case and the other case, we get the day to operation a very long time, very in the 21st of November. How come that you can make it short?
So the other advantage in India is our processes are oriented towards patient. We don't have waiting time. So as soon as the patient comes in, we have a consultation with the specialist, and then we start the examinations, and we are ready for surgery. We built in our processes and our capacity. We have so many operating theaters, we have so many doctors. The idea is not to delay the treatment of a patient who is already sick, because the delay can make the condition worsen for those patients. So we have systems to make sure there is no waiting time in India.
How come? Because many jobs that you make so many things to catch for observation and very roughly. What do you say about that?
So one thing why we can do it faster than others is, if I may say, our doctors, our technicians, the nurses, our medical staff are very hardworking people, and they work late also. Our labs are operational 24 hours. Our services are functional most of the time. So that helps us to make sure that if we have patients coming, we have capacity to serve them.
I saw the machine of the ZX. Can you explain about that?
ZX is a revolutionary technology in treatment of certain types of brain tumors. Apollo is the first one to bring that to India. Apollo actually has been always the first hospital, the pioneer and the leader to bring the latest technologies from the world to India. And Zapex is one more example of that. Typically you'll have to undergo a surgery in some tumors, or sometimes the tumor is not even operable. In many such cases, the Zapex treatment can be done, which is an outpatient-based treatment. You don't have to come and get admitted and undergo surgery and stay for hospital for 5, 7, 10 days. Here you come, get a session done. It could be 45 minutes approximately. And most of the cases will only need one session of this technology. And in some cases, you may need a second session, and you're treated with your tumor. So it's a highly successful treatment for certain types of tumor.
What's the differences between the Zapex and the conventional one?
So end of the day, see, the tumor, brain tumor, some types of tumor, either you remove it surgically or give you a radiation. But this technology gives a highly specialized, highly focused radiation in a way, and that helps you kill the tumor and make sure that it is done in one sitting.
How about the cancer, the proton?
So the other facility, this is more for the head and neck issues, but overall as a cancer is a growing problem globally again. In India we are seeing. So we have the latest advances in all of those in medical oncology, radiation oncology and surgical oncology. Specific to radiation, we have the Proton Center at the Apollo Proton Cancer Center in Chennai, which is again, like I said earlier, the first facility of the kind in not only in India but entire Southeast Asia. In fact, I'm told now Singapore is going to build one. They recently started a proton facility, but Apollo has it for the last 6-7 years.
Gosh.
So we brought that technology to Asia before. Countries like Australia don't have that technology. So Japan has, and I think Taiwan, a few countries, but Apollo in India was first to bring in this part of the world.
The Zapex and the proton is built in India, or you just...
No, they are not built here. They are not Indian equipment, but we bring them to India.
Oh, it's from where?
It's from globally, from US and Europe.
Oh, okay.
Primarily US.
So doctors, of course, in Indonesia only the rich people can come here to get the hospitality here in Apollo. Do you have any suggestion that how can the poor people can come to have the serve here?
So I like to share here, that is what the Apollo model is, that not only the rich can come, the people who are not have high resources can also come. That's what I'm saying. In $5,000, a lot of people can afford a heart surgery. They can come. But on the other hand, we are not looking at patients only coming here. We are working with hospitals globally. We have partners in the government and the private sector across the world, where we help in knowledge sharing, skill transfer and training. So similarly, we are working with a leading hospital group in Indonesia, the Mayapada group, where we'll be working and bringing some technology from Apollo to Indonesia.
Do you think you can make a surgery, the liver surgery in Indonesia?
Oh, why not? It can be planned.
Right now?
Yeah.
Or how many years?
Maybe, see, once the program probably picks up, it could be 6 months to 1 year it can start. We have helped develop such programs in other parts of the world, in our neighboring countries like Nepal and Myanmar, where our surgeons have helped the surgeons in those countries to train in that area. Not only the surgeons, the support staff, the nurses, and we can help a good training program for liver transplant in Indonesia as well.
So you will do the operation, or you just assist the doctors?
So it's a long process. First the doctors from a partner hospital have to come and work and get some training and observation here. Then our teams travel with the surgeon, and his team travels with the equipment and required consumables to probably do 1 or 2 surgeries with them. So it's a gradual learning process, but it can be done. Yes.
One more thing, body cancer. Can you make a comparison like the heart and the...
Even I won't cancer, different types and the treatment modalities will differ. But again, I'm saying confidently the cost of treatment will be 1/5 of what would cost in Singapore, or maybe 1/10 in some cases.
Okay, for the last, what to call to the Indonesian people?
Firstly, I say stay healthy, follow a good lifestyle. 2, get regular checkups done. So Apollo has India's largest preventive health check program, which we'll again be happy to bring to Indonesia, where you can get your regular checkups done, so that in case something is going wrong, you can catch it early and you can make sure there's an early detection and you can take the required treatment immediately. And if you need some complex treatment, it will be we are here to offer you that help.
Do you have staff information to have a contact with the Indonesian?
So we have a Apollo office, Apollo hub in Jakarta. So Mr. Gaurav Malhotra and Ms. Ripka are there. and they help people in Indonesia who need to come to Apollo hospitals in India. And I'm sure you can get those details from them, and they will be happy to support any other Indonesian who is looking for treatment at Apollo in India.
Okay, thank you very much, doctor.
Thank you, Pa. It's a pleasure. Thank you, Pa.